About 3 years ago, the world experienced a respiratory disease that eradicated almost 7 million people. This global crisis of COVID-19 is similar to another virus that hit the globe in 2002, referred to as SARS. Some parts of the world, such as Canada, saw higher rates of safety over others during the SARS pandemic. During the COVID-19 pandemic, it's beneficial to look at the successful safety measures and how they can be integrated into facility leaders' COVID-19 plan of attack. A shift has been seen in hospital design because it now revolves around surge capacity, which is how healthcare facilities and their staff adapt inside their buildings when the number of sick patients increases substantially. We are going to take a look at ways to allow for future flexibility and adaptability with building systems, equipment, and technology. First, it's critical to have a strategic master plan that is created for flexible, innovative, and integrated building systems. Cameras should also be utilized throughout the facility for everyday task performances, such as remote equipment monitoring. Next, bold visual and graphic displays should be implemented and include wayfinding, messaging, and patient status. Simplify as many tasks as possible with sensors, proximity devices, infrared scanning, motion detectors, and more. Specifically, you could install touchless entry doors and other sensors in busy spaces. Avoid unnecessary touching of surfaces with phone apps, using your voice, sensors, and other similar devices. Following, strategically place additional antibacterial receptacles around the facility. Use commercial human thermal scanning to alert staff of guests with high temperatures. Power systems and telecommunication systems should be established with built-in automatic switching redundancies. Establish a telecommunications consistency plan and establish options for telehealth. Provide remote communication for those COVID-19 patients recovering at home. Implement management tracking and contact tracing to help regulate the spread of viruses. Also, keep a record of your equipment as far as where it has been and who has come in contact with it. Next, help to adapt electrical and technological systems along with other efforts to minimize virus transmission. Implement a clear and simple process for staff to work remotely and access their workstations if possible. Consider a plan for resilient Wi-Fi and connectivity. Eliminate single points of failure in power and mechanical systems by developing an infrastructure analysis. Last, aggregate sensors for big data capture and analytics as a precursor to building artificial intelligence applications. Please check out the associated blog post titled From SARS-CoV-1 2003 to SARS-CoV-2 2019 Part 10 Future Planning, Building Systems, Equipment, and Technology on JPT's website, which contains more information and materials for download. JPT hopes that you will keep tuning in and following along to see how your facility can be pandemic prepared. See you next time.